This week marks International HS Awareness Week, a campaign dedicated to raising awareness of Hidradenitis Suppurativa, or HS, which is a painful long-term inflammatory skin condition that affects more than 74,000 people in Ireland. But despite its prevalence, HS remains largely misunderstood, with many sufferers facing years of symptoms before receiving a diagnosis. One person working to change that is the Parteen native Barry McGrath, who lives with the condition himself and is chairperson of HS Ireland. Barry, thanks once again for joining us on Morning Focus.
Good morning to you, Alan, and good morning to all your listeners, and thank you very much for hosting us yet again. We've been coming into you since 2021, and we appreciate the opportunity to raise awareness of this common but little known condition.
And we're only too delighted to, particularly because, as you say, it is common yet little known. So the more awareness that can be raised of it, the better. And as I say, Barry, it's a painful long-term inflammatory skin condition, but there's so much more to it than that. As someone who's lived with it for many years, can you give our listeners who may not be familiar a sense of what it is like to live with HS?
Sure, yeah, delighted, Alan. It starts off as painful leaking lumps that develop in intimate parts of the body, typically where skin meets skin. So you're talking about the breasts in females, the backside, the genitals, the groin, and the armpits also. Due to this, people are reluctant to actually go and seek help in the first instance, and often delay it by about 2 to 3 years. Then when they get into healthcare, because of the poor awareness amongst healthcare professionals, the diagnosis is often delayed, and on average it takes about 10 years for someone to learn that they have this condition. Unusually amongst conditions that manifest on the skin, it can progress over that time. So by the time that they receive that diagnosis, after 10 years, it's progressed to the stage where you've got irreversible scarring, you've a lot of other associated health conditions, cardiovascular complications, arthritic type conditions, hormonal complications. And by the time people get into healthcare and get to see the right people, they are often in a bad state and need a lot of healthcare resources thrown at them. In addition to the physical complications, as you can imagine, there are a lot of psychological complications because it's affecting the intimate parts of the body, anxiety, depression, and all sorts of mental health complications. Furthermore, it tends to develop at a time of life. The average age of onset is about 21, 22. At that point, people are thinking about boys, girls, settling down with families, getting on with their careers, and HS can impact all of those major milestones in life. So the longer it's delayed and the longer people wait to get a diagnosis, the more it's costing the person who's affected, it's costing people in healthcare, and it's costing us in society at large.
And you know only too well what that's like. You've told us before about going through this in your later teenage years and the scarring on, you know, your mental health, the embarrassment that can come with trying to keep it from people, and the impact it can have on socialising, as you say, when you know you're looking to meet someone else and all of that. And it took many years before you finally sort of were presented with a brighter path.
Yeah, in my own case, in addition to living in Ireland, I lived in the UK and I lived in the Netherlands during the time to diagnosis. And in total, it took me about 20 years to receive the diagnosis. Yet the GP who diagnosed me in Galway, when I met with him, took him 2 minutes to actually diagnose me. So it's simple when you know how, and there's no need for that extensive delay. When I was diagnosed, things did begin to change, and they changed very, very slowly. I met with a fantastic dermatologist and a fantastic plastic surgeon, and together, between them and their teams, they slowly transformed my life. Now, I've been accessing healthcare services for this for several decades, and the changes I've seen in that time are phenomenal, so much so that when I was diagnosed, there were no available treatments. We now have 3 treatment options available to people. There are more in the pipeline. The European Medicines Agency are currently reviewing more treatment options for people. And just last December, we good news in this country in that the Health Services Executive have decided to reimburse a new treatment that became available at European level in 2024. So now people in Ireland will have access to another new treatment. There's loads happening in the area. Specialty clinics are emerging all around the country, and knowledge and understanding of the disease is improving all the time. And while it's all going in the right direction, there's still a bit more to go yet. And we're working closely with researchers, with doctors around the country to try and improve things, not just for people with HS. Families are impacted, employers, educators, and society at large.
Barry, you are chairperson of HS Ireland. What kind of support does the organisation provide?
Because HS affects intimate areas of the body, we provide a lot of online resources whereby people who are affected can access things in a way that respects their privacy. Now, we have over 2,000 people in our group, and we run, with our colleagues in the UK, we run monthly education and peer support meetings whereby we have invited in specialists in various aspects of healthcare, from psychological support to surgery to research to clinical trials, etc. And they'll come in and give an informal presentation online. And after our healthcare specialist leaves, we stay on for a peer support meeting. Now, an awful lot of people in our group access the peer support. Again, people tend to be very private about HS, so online is very conducive to that. In addition, we work closely with a lot of researchers, both in Ireland and internationally as well, making sure that, their focus of research is what matters to the people who are impacted by it. And we also devote a lot of resources towards informing future clinicians. We deliver presentations to healthcare students around the country in disciplines of medicine, nursing, pharmacy, and other allied healthcare associated areas. And thus far, we've delivered presentations to about 1,000 healthcare students, many of whom are now working in healthcare. So we're planting the seeds there that will hopefully germinate, and the next generation of people who go accessing healthcare will not have to wait that average 10 years before they get diagnosed. The sooner they can get diagnosed, the sooner they can access the care and support that they need, and better outcomes for everyone.
Barry, if someone is finds himself in the position you did all those years ago when you first discovered you were living with hidradenitis suppurativa, and they recognise some of these symptoms in themselves, what should their initial steps be?
Well, the key question to ask is, have you had an outbreak or an episode 2 or more in the past 6 months in any of those areas mentioned, like armpits, breasts, groin, genitals, backside? Go seek help. Go in and speak to your doctor as soon as possible. Put aside your pride, moments of perceived embarrassment, as in having to undress in front of a doctor. They're professional people. They will care for you appropriately. Because a lot of doctors may be unfamiliar with it, go into them with that name, Hidradenitis Suppurativa. You can access, we have a lot of resources on our website. Bring those in, download them, bring them into the doctor with you, and ask them to rule it in or out as soon as possible. And thereby you can get the accessing care that you may need as soon as possible. We have a lot of other resources on our site and access to other people. People feel very isolated with this condition, and in whatever way that they may feel comfortable with, they can access other people, share information, resources and experiences with one another. Whatever people are going through, chances are someone will have gone through something similar and can open the door for them or help guide them in the right direction.
Well, we appreciate you joining us, Barry. International HS Awareness Week, really important in highlighting hidradenitis suppurativa, which many people may not yet have heard of. Thank you so much for being with us, Barry.
Thank you very much, Alan.
That's Barry McGrath, the Parteen native and chairperson of HS Ireland, with us on Thursday's Morning Focus.